Cancer is one of the world's leading causes of death, and its burden is growing. Just last year, the world crossed a sobering new threshold. An estimated 20 million people were diagnosed with cancer, and 10 million died. Now, these numbers will continue to rise in the decades to come. The theme for this year's World Cancer Day, which was yesterday, is closing the care gap. And with that in mind, we want to know what has been the impact of COVID-19 on cancer treatment in this country. To help us unpack that, we're joined tonight by Salomé Meyer, Project Manager for Access to Medicine and Cancer Alliance. Salomé, a very good evening to you. Thank you so much for your time. Let's begin with that very question. How has COVID-19 and the subsequent lockdowns and restrictions around access to hospitals impacted on people who need this very urgent cancer care?
Good evening to you and to all the viewers across the globe. Well, COVID obviously also impacted on cancer, and specifically in the hard lockdown, people were not able to actually even get to their treatments. And if they could, treatments were scaled down. But I think the most hardest hit are actually people at primary care level, where they actually had to go for their screenings. And that in itself is a major problem in South Africa. As it stands, our primary screening at primary healthcare facilities are not the very best in the majority of our provinces. And that has definitely COVID impacted there. So what happened subsequently is that, yes, all the tertiary treatment facilities have now gone back to the normal treatment schedules. So, yes, our patients can be treated at the various treatment centers. However, there is one treatment center, and that remains a big problem, and that is Charlotte Mckay Care Hospital.
And that's caused major disruptions for people who rely on public healthcare facilities in Gauteng for cancer treatment. In terms of bringing it back online, I know the oncology service was brought back to some degree at Charlotte Mckay. How effective is it? How many people are they actually able to assist?
I cannot actually say to you how many people they are able to assist, because they are back in, that is in the medical oncology. They are back to the normal treatment of their patients at Charlotte Mckay Care Hospital. However, the problem that we have is with radiation therapy patients at Charlotte Mckay Care, and this is a problem that actually existed long before COVID. So it's not a COVID problem, and it's also not due to the fire. Remember, we also had the fire last year, April. What is the issue at that hospital, and therefore the theme of close the care gap is so absolutely important, is that that hospital do not have enough equipment, radiation equipment, to treat the backlog, patients on a waiting list at that hospital. And also they don't have enough staff associated with treatment. So that in itself is a major problem. And we, in fact, launched a petition yesterday that is earmarked for the Premier of Gauteng, the MEC of Health, as well as the CEO of Charlotte Mckay Care. And I can say to you, thank you to those who have supported us thus far. We've already got 6,800 signatures, and actually demanding that, it is time to act, close that care gap. What we're asking is not for, is not out of, I want to say, impossible. We're asking specifically for a dedicated task team to be put together that consists of, obviously, the Gauteng Procurement Department, the Health Department, as well as the treatment specialists and civil society, to actually look at cancer care in an integrated manner in Gauteng. Because what also has happened in Gauteng is that in 2021 they procured machines, in fact 3 machines, for Chris Hani Hospital as well as George Makuri Hospital. This is whilst Charlotte is needing machines. These machines are now in storage and will remain in storage until the bunkers for those machines have been procured and have been built. And that means that only possibly in the beginning of 2023 will those 2 radiation oncology departments be operational. When you then ask the question and the personnel associated, the answer was, well, if we don't get the dedicated staff, we will have to take staff from Charlotte Mckay Hospital as well as Steve Biko. Charlotte hasn't even got enough staff. Charlotte hasn't even got the machines, and there's a waiting list of 2,000 patients. So surely somewhere we need to find a solution for this.
A waiting list of 2,000 patients, you say. Let's speak about the urgency of the treatment that they need and how quickly they need to have it in order to survive, possibly.
So the normal is that a patient should have, after chemotherapy, they should have their treatment within a 3-month period. And that depends then on the treatment center, how quickly they can actually assess them and then book their treatment planning in terms of the specific radiation that they need to get. And what we have now is that we have more than 1,000 patients, prostate cancer patients, that have been on a waiting list for longer than 2 years. We have a number of breast cancer patients, more than 800, that was also on a waiting list. And unfortunately for some of these patients, it's going to not necessarily be good news, because all these patients have to be recalled, reassessed, and we already know of 1 patient that has died, 1 patient that have actually has been reassessed and is now, in fact, in Charlotte Mckay with metastatic breast cancer. Then we have cervical cancer patients that is also waiting for their treatment. And then the saddest part of all is the palliative care patients that are waiting. Those are patients literally at the end of their life. And you give them palliative care radiation to relieve them from pain. So it's not necessarily the best picture that is being painted when we start talking about a waiting list of 2,000 patients, and we have machines that are procured for other hospitals, whilst we had the ability, in fact, to actually procure machines for Charlotte Mckay Hospital. Surely somebody needs to be held accountable for that.
Salomé, let's leave it there. Salomé Meyer is the project manager for Access to Medicine and the Cancer Alliance. Thank you for your time.